My name is Dr. Zhang. I'm the medical oncologist and hematologist from Illinois CancerCare. I have an office in Town Square Center in Dixon and come to town to help people who has cancer or who has blood disorders. Today, I'm going to discuss my favorite topic. We're going to talk about the breast cancer. So what you really need to know about breast cancer? Breast cancer is an age-specific disease. So before age 40, for example, you have a 30-year-old, the next 10 years, the risk of getting cancer only 0.5%. But if you jump to 40-year-old, your risk of developing a breast cancer in the next 10 years up to 1.5%. That's why we recommend all people to have a baseline mammogram at age 40. So at age 70, the risk of breast cancer in the next 10 years jumped to 4.5%, meaning 1 out of 25 people will have a breast cancer. The lifetime, you'll have a breast cancer about 12.8% in the next 10 years, meaning 1 out of 8 people will have a breast cancer. So what this means, breast cancer is very common in the community. So what is the risk factor for breast cancer? And what can cause breast cancer? And a couple of things we need to be aware. Number one is the high penetration gene mutation. For example, patient who has BRCA1 or BRCA2 mutation, P53 mutation, P10 mutation, and a PALB2 mutation. Those gene mutations put patient at a relative risk of 20% higher than normal people to developing a breast cancer. Other disease or benign disease can cause cancer too. For example, DCIS, LCIS, and family history, or people who had chest radiation therapy in a young age, especially when people who is less than 30-year-old. People also can have a risk of breast cancer if they are older. Older people, age is always a high risk of breast cancer, especially for age more than 65-year-old. Now, some minor risk factors also can cause breast cancer. For example, alcohol consumption, early menarche, and people who has inactive lifestyle, even depression, obesity. Those are the minor risk factors for breast cancer. What do you do if you suspect a breast cancer? Or what do you do, or when do you think you have a breast cancer? And people who has asymptomatic or painless lump, especially in people who more than 40-year-old. If you feel something in the breast, it doesn't hurt, but that actually is an alert sign for breast cancer. A second sign for breast cancer is people have a swelling breast, the skin getting red and the skin that did not respond to antibiotics. Because usually if you have these symptoms, the doctor gives you antibiotics, say, hey, that's a skin infection. But please be aware that if the antibiotic doesn't help, the thickening, the reddening is still there, you need to call the doctor to rule out the breast cancer. Other real symptoms for breast cancer including the breast heaviness. One breast is much heavier than another one. The nipple abnormal discharge, which is not supposed to be, like blood discharge, milky after menopause. People who has breast pain or skin or nipple retraction, those are really a risk sign of breast cancer that need to be worked out. By the way, most of the time, the breast cancer does not cause pain. Most of the time, the pain in the skin, in the breast, is not related to the cancer. What do you do if you suspect a breast cancer? You need to contact your doctor, either your primary doctor, or contact us in Town Square Center. What we do a very thorough breast exam. We'll check your breast, check your neck and axilla to be sure you don't have big lymph node. Or usually we refer you to do a mammogram screening, Sometimes we need a diagnostic mammogram if I can feel the mass. Ultrasound also recommended. For some people, they need a mammogram. They need an MRI of breast because the dense breast. Biopsy eventually is needed for tissue diagnosis. By the way, most masses or lumps you feel or found in the mammogram are benign, in not cancer. Especially in the young people, you found something, likely it's not a cancer, but it's a benign adenoma or cyst or papilloma, those can be benign tissues. Breast cancer, you can see this map in Illinois. Illinois is a high risk of breast cancer death, high mortality. So it's critical for a lady who has family history of breast cancer or who has a risk of breast cancer that need to be checked by the doctor, need to get a breast screening test. Small breast cancer usually cannot be filled. That's why you need a mammogram screening. Early diagnosis for breast cancer is a key because the early the cancer diagnosis, the highly likely be cured. When the cancer spread, it's bad because most time there's no cure. So for cancer screening in breast cancer, most common one we're using for mammogram. What is mammogram? The mammogram is a low-dose X-ray image for the breast tissue. It have a 2D versus 3D technology. 3D technology is doing great. You can have a very clear picture and very sensitive to detect the breast cancer. Breast cancer screening really helps. There's a randomized clinical trial and compare the people who had a breast mammogram screening versus who didn't. They found that people who had screening by mammogram, their breast cancer death decreased by 20%. The overall reduction in the breast cancer death about 20%. That's pretty good. The data from Europe and from Canadian data, which showed the risk of breast cancer deaths was reduced by more than 40% among the women who had a screening mammogram. So there's very good data to support the breast cancer screening. So we recommend a baseline screening mammogram between the age of 40 and 45. So after 45-year-old, including 45-year-old, you need to get yearly mammogram. For high-risk patient who has family history, who has dense breast, they can have a breast screening every twice a year if you're more than 55-year-old. So there's another common question is that how long you need to get a mammogram screening. So the guidelines recommended that you continue screening mammogram as long as you're healthy and your overall health is good and your life expectancy more than 10 years. In other words, if you're healthy, you're doing great for next 10 years, you should continue mammogram screening. All right, what is new in breast cancer treatment? If you do have a breast cancer, what can we do? Surgery is a well-known modality for breast cancer treatment. Surgery can be mastectomy versus lumpectomy. Mastectomy is a surgery that we remove the whole breast and also remove some lymph node. Lumpectomy is just remove the breast. A small surgery, they're doing great. And lumpectomy with radiation just as good as mastectomy in terms of overall survival. The next treatment modality for breast cancer is radiation therapy, which applies for people who have lumpectomy, who have mastectomy but with a positive margins and positive lymph nodes. Chemotherapy is a well-known treatment of breast cancer. And when people hear chemotherapy, they're scared. Oh my God, I got chemotherapy, I'm gonna lose my hair, I get a lot of side effects. My friends that die from the chemotherapy. Those are bad information people get from the online, from the internet. But let me tell you, the chemotherapy in nowadays is much better. People doing great because of new medication, the better supportive care, better tolerance, and less mortality and morbidity from chemotherapy. So don't be scared about chemotherapy. I'm the one giving chemotherapy. So if you have questions regarding chemotherapy, come to my office in Square Town Center. We can discuss more about that. So next treatment is hormonal therapy. We also call that endocrine therapy. That applies for people who have ER and PR positive breast cancer. That's not a chemo. They're doing great. You can take the medication just like you take Tylenol. Easy and effective. Other more interesting treatment options including immunotherapy and target therapy. Target therapy is applied for people who have HER2 positive breast cancer. We have medication specific targeted HER2 protein that kills the cancer. Again, that's not a chemo, not a traditional chemo, but it targets the specific protein in the cancer cells. Works great and less side effect. People tolerate very well. Immunotherapy is a new emerging area of breast cancer treatment. So it's how it works. We give the medication, it boosts your own immune system. That your own immune system kills the cancer. I call it natural killing. It works very well, and most important is if it does work for you, it's going to be a durable response. Patient can do great for a long term because that's a natural elimination of the cancer cells. So it is approved for people who have triple negative breast cancer at this point, but we have more study going on to treat other cancer, other type of breast cancer as well. The last treatment for breast cancer is called CD4/6 inhibitor. It is approved for people who have ER and PR positive breast cancer for CD4 disease. That works great. It's a pill form treatment and doing wonderful. Less side effect and works very good. Now, those treatment is not chemo at all. So as you know by now that breast cancer not only can be treated with chemotherapy, but can be treated with hormonal therapy, immunotherapy, and CDK4 inhibitor, which totally not traditional chemo drug. You will not have that toxic reaction. Okay, the last we're going to talk a little bit about genetic testing. So people keep on asking me, doctor, my mom has cancer or my sister has cancer, do I need to do the genetic testing? Why do I need the genetic testing? So a genetic cancer risk assessment really influences the surgical decision and also influences the care of the patient and the patient's family. In other words, it's not just for the patient, it benefits the family members. So who needs genetic testing? And people who has triple negative breast cancer, okay? Who has cancer that developed at a young age, usually less than 50-year-old. Who has breast cancer at any age with a relative who has cancer that diagnosed less than 50-year-old. Of course, people who has male breast cancer need have a genetic testing, which is not commonly seen. Female breast cancer diagnosed less than 50-year-old, as I said, that is an indication for genetic counseling. People who is from Ashkenazi Jewish individual with breast cancer of any age, because they are the high-risk group getting breast cancer as well. So if you have a question for genetic testing, please come to my office. We have a genetic counseling team in Illinois, in Peoria. So in Peoria, Illinois, so we are more than happy to help. That can be done virtually. You don't have to travel to Peoria. We can do it using through the internet. Okay? All right. Thank you very much. If you have a question, please call me, and we're more than happy to help. All right.